Welcome to the EDS Scan Data Series. In this video, we will review what makes a lab-ready scan for crown and bridge restorations. These steps will help reduce remakes, speed up case turnaround, and set the foundation for effective restorations. For this example, we will be using the iTero scanner. If your practice uses a different scanner, refer to their specifications. When scanning for a crown or bridge, include a full arch scan of the upper and lower jaw, and a bite scan for accurate occlusion. When reviewing the scan data, confirm all of the following. First, the tooth or teeth have a clear visual margin. Second, there are no undercuts, gaps, or overlapping data. And finally, there is enough room for the restoration to sit comfortably in the patient's mouth. If the scan does not meet all of these expectations, the best solution is to try scanning again. Excellent restorations start with great digital data. If you have questions, contact us using the information on screen. Thanks for watching and happy scanning.